Hello and welcome to our Facebook Live on posture and aging. I'm Dr. Mary Elder. I'm one of the doctors at 4 Points Family Chiropractic. We are located in Northwest Austin, Texas. And Dr. Neblett was on here last month talking about posture generally. I want to talk a little bit more about how it impacts your aging and things that you can do on a day-to-day basis to help train your body to have better posture. And he went over some of these too, so some of it should sound familiar. There's no quiz at the end, but just so you know, there's going to be more than one source for material here. So we know that posture through research and just through observation has a direct impact on how well you age. Physically, mentally, even socially, because it affects how your body shapes over time and how you age. So just kind of the general ways that it does is we'll start with kind of the less serious ones, which is your appearance and honestly your confidence, which impacts kind of how you show up in the world. So you'll notice people who have good posture, like shoulders back, chest up, looking straight ahead, like you can spot them. And if you are watching somebody with poor posture, like you might notice. It also kind of makes you tired when you're forward like this. And the reason is your posture actually impacts your breathing and your energy. So when you say you've been sitting on like a bench with not a good back. I heard this from people who like spend the summer doing things like Disney and Universal. Like you're not in good posture because you're sitting or standing for long periods of time and you get tired. Well, it actually impacts your energy over time because your proper posture opens up your rib cage so your lungs can expand all the way. But when people are kind of forward like this, their lungs actually don't expand. Their diaphragm doesn't go down all the way, so they can't get as much air into their lungs, so their breathing is more shallow. And the oxygen delivery is not as good. Now, the problem is that posture is cumulative, right? That's a long-term thing. So reduced endurance is also something that we will see. So you might notice that if you are somebody that's at a desk for long periods of time and you have been for the last few years, and maybe you get out and you try to run or do an activity and you're like, man, like this used to be way easier to breathe. That might be one of the things that's happening is your diaphragm has to get used to expanding all the way again. And that's directly related to posture. Your posture also has a direct impact on your muscle strength and your balance. So that upright alignment, keeping yourself upright, activates particular muscles, and it keeps your core strong, your back, and your hips. Obviously, we're going to care about that, but you should too. That slouched forward head posture, it weakens your deep stabilizing muscles. And those also increase fall risk, which I feel very strongly about. I think when fall risk goes up, that risk of injury goes up. And if you can keep your balance and your proprioception as healthy as possible throughout your life, that should really be a priority. Like, please pay attention to it no matter what stage of life you're in. Your posture and your balance has a direct impact on how you age, how healthily you do it, and whether or not there's fall risk and risk for injury down the road. Now, you're talking to a chiropractor here, so posture obviously directly reflects your weight even distribution, so your joint and spine longevity. We want to keep that going as strong as possible, as healthy as possible. If you've spent any time here in our office, one of the things that we do to assess is we're looking at your bilateral posture. So how well do you balance your weights? A healthy spine should be straight up and down, and you should balance your weights evenly on both feet or within about 2 pounds. So good posture helps that happen, and you do have to pay attention to it, but it keeps the weights balanced evenly, which reduces uneven wear on your discs, your ankles, your knees, your hips, all of these joints that we want to last us for a long period of time. It also, poor posture accelerates your degeneration. And if you know anything about our office, we are actively combating degeneration in your spine all the time. We coach on it, we talk about it, we observe it, as much degeneration avoidance as we can do. We want to make sure no discs get compressed, damaged, or any sort of arthritis or limited mobility. And then, of course, nervous system and brain health, that goes right with it. So spinal alignment influences nerve signaling between the brain and the body. Chronic misalignment can irritate the nerves, which affects your movements, which affects your sensation, which affects your coordination. So just kind of going back down that line of making sure that you age really well. Now, obviously, as chiropractors, one of the things that we check for is where that's happening. in the spine. So if you need to get your posture checked, or you know anybody that does, they're exhibiting kind of poor posture, you're concerned about how they hold themselves, sit, stand, they're complaining about any of this, they can come in and get a full assessment in our office, which includes a posture analysis, a neurological check, any necessary x-rays. That's normally $348. If they mention posture from one of our 2 talks, then they come in and get that full assessment for $97. So it's just something that we can offer to check and see where the posture imbalance is coming from and if it's something that needs to be addressed. So the bottom line, over time, your posture acts like compound interest. So the decisions and the little tweaks that you do now have a direct additive factor. So the small daily habits will line up. Good alignment in your spine and in your body preserves your mobility, your lung capacity, your independence, just as long as you can. Now, when we talk about posture, there's 2 different types of posture to consider: static and mobile. Now, in posture, mobile refers to movements and positions that your body goes through with dynamic movement. So when you're standing, moving, walking, carrying things. Static is when you're like sleeping or sitting, when you're not moving at all. So knowing the difference matters because they each place different demands on your body and on different muscles, different parts of your nervous system, different joints. And an imbalance between the 2 can cause long-term issues. So it's the 2 that you want to be balancing. So static posture, like sitting or standing, relies on endurance muscles, your postural endurance. So if it's weak or deconditioned, then you fatigue really quickly. And that will lead to things like slouching and joint compression. So in order to be upright and contain or have good posture for long periods of time, there are certain muscles that I need to have working. Diaphragm's one of them. You need the core to be working, you need your upper back muscles, and you need your paraspinals, the ones that run along your spine. Now, if there's nerve interference there, those muscles are going to have a hard time acting appropriately, and in fact, your body will put you in positions that take pressure off the nerve. So that's one of the things that we check for in our office when we're looking at posture, is why is your body putting you in a questionable posture? Because there might be a reason neurologically that's happening. Now, mobile posture, which is how you move through space, that demands different things. So fast twitch muscles, your quick response muscles, it demands coordination, stability, and controlled range of motion. Like when you're walking, you're not throwing your leg out. You have to have like a controlled step and follow through with the step. So it's a different set of muscles that's doing it. Those muscles shorten and then lengthen, and you need it to do it in a coordinated way. So problems often happen when static posture dominates your daily living. It's hard to avoid at this point. Maybe you take a long commute, or you have to sit every single day at a desk, or you're standing for long periods of time on your feet. Those things imbalanced with movement, which is what we should be doing just as often, is what will cause postural imbalance issues. So as that happens over time, your mobility decreases and your neutral posture starts to deteriorate. So when we do the assessment, we're looking at you standing from the back and from the side, but we are often observing you as you were sitting also, because we will notice that people will start out upright, and we see that sometimes within a few moments, which isn't very long, people will fatigue into this position. I see it a lot in students. It's like they get tired in the upright position, or on the other flip side of that, mentally they see no point in being in that upright position, and over time that compounds into an inability to actually hold that position. So we want to make sure we're giving you strategies that you can use to maintain that good position, in addition to getting your spine checked. So just make sure you're striking a balance. Shift your position. Every 20 to 30 minutes is a good idea. Your body will almost certainly do this naturally. You get uncomfortable in certain positions after a long period of time. Try not to cross your legs or sit in imbalanced positions. I know a lot of people kind of like swing legs up, cross their legs. Try not to do that. Try to maintain neutral, balanced positions. You can set a timer for 20, 30 minutes if you don't feel like you're doing that naturally. There are these great cube timers that I've been seeing, that each side of the cube is a different amount of minutes. I think they're meant for ADHD time management, but that's what I would use it for, is posture changes. So every 20 to 30 minutes, try to change whether you're sitting, standing, or the position that you're sitting in. Mix your mobility and your stability work. Just try to consider those when you're doing your workouts. So make sure you're walking, stretching. You can do joint mobility drills, and those will strengthen your core and your posture muscles. Train your posture in motion. When we talk about posture, often we are talking about sitting position. So like in your car, as you're watching TV, on the couch, as you're doing your work. But you want to make sure you're focusing on your posture during dynamic things also. So when you're walking through HEB, like don't be leaning on your cart. Try to keep yourself upright and keep your core engaged. When you're unloading groceries out of the car and bringing it into the house, try to make sure you're balanced and you're upright. When you're, putting the groceries away, try to make sure that you're upright when you're cooking, et cetera, et cetera. I really took you through a whole meal there, but make sure that you're paying attention when you're doing the dynamic motion also, because it matters just as much, and that's going to train your body to do what it's supposed to do. And I also suggest micro breaks every probably 4 to 5 minutes. And I know this is a hard thing to remember. Your body might do it naturally, but try to like roll your shoulders back, move your neck around, even do some twists. That also resets your posture. So it gets your brain to consider it again on a conscious level so that your subconscious doesn't have to work so hard. Eventually that switches and your subconscious does it by itself. You don't need to think about it as consciously. Take some time. Don't get frustrated if you don't do it. But try to consider doing little micro breaks like that. So there are some things that you can do like quick resets. You will often hear us talk about YWTs, where you get up against the wall, put your arms like this and push your head back and just resist back. Take a couple of deep breaths. That's a good position to get into. You can do dynamic flow, just like things like stretching, walking, neck rolls. Cat-cow is a good one. Torso twisting, but not where you crack your back. Don't go that far. It's not good for you. You can also do more involved things like planks, hip openers, overhead reaches, side to side. All of those are good strategies to use. But sprinkle that routine in a couple times a day, especially after long periods of screen time. It teaches your body to transition smoothly from stillness to movement, which is kind of the sweet spot for long-term postural health. And you might have noticed this in yourself. I will sometimes, if I've been sitting on the couch for a long period of time and I get up and go to move, I'm like, ooh, I gotta like shake it out a little bit. That's not what we want. We want our body to transition really, really smoothly. So that's a metric for you to keep an eye on. If you have noticed that it's difficult for you to make transitions smoothly, or it takes you a little while to work out some things, again, we check for that. That's one of the big things that we look for. Transitions are big in spinal health. We have to be able to transition quickly and efficiently. So if you know someone that needs to get checked, you need to get checked. We do a full exam in our office, including posture analysis, neurological check, any necessary x-rays, and a review of findings with the doctor. That's normally $398 or $348. If you call in and you mention posture or one of our 2 Facebook Lives, you can get that full exam for $97. Just a way to get checked. But that posture focus that I'm urging you to do, it rewires your brain, which trains your nervous system to recognize and maintain healthy alignment automatically. We want your body to be doing a lot of it by itself. You don't have to constantly think about it if you do the training right up front. So proprioception drills also help. These are some things that you can consider. So balance drills, we talk a lot about that. If you are seated at a desk for long periods of time, consider a balance disc. You can sit on it. Don't sit on it the whole day. You'll get sore, but you can sit on it and it challenges your core so you can't slump. And that's a really good thing to consider as well. Another thing that works, it's a little uncomfortable when you first start doing it, is called mirror or video feedback. So if you put a mirror over here to the side or film yourself, you will notice how quickly you start to go in like that, and you can notice and correct it. It's uncomfortable, happens faster than you think it does. But if you do that repetitively, you can do it until it feels normal to be in good posture, and then you don't have to do it anymore. Make sure you're focusing on those muscles when you are doing workout. So deep core, you want to make sure the mid back and the glutes are all strong and firing the way that they're supposed to. The wall angels I was discussing, bird dogs are good exercises, bridges, planks, within reason. Make sure you talk to your doctor first. Some of those positions, depending on your spine, we want to make sure that we modify them to be good for you. Making sure that you anchor your posture to habits that you're going to do anyway. So maybe every time you get on a call, you get up and you walk, or you make sure that anytime you get up from your chair, you bring your shoulders back, you tuck your chin. One that I like to recommend, a lot of us are on our phone. Every time you pick up your phone, put it up at eye level. Just get yourself in that habit. You're not going to be perfect all the time, but that keeps you from doing this, which is what brings you forward and impacts your posture. Those repeated cues create neural triggers, which means that your body builds a pattern in that position. So again, you do not have to think about it that often. The less thinking you have to do, the better. And then practicing your posture in motion. So walking, lifting, bending to pick something up. Just make sure you're conscious of your posture while you do it. Again, you will get stronger in that right place. And then you just reset as much as you can, as many times as you need to. The big takeaway here, the brain will rewire itself through frequent, repetitive motion. Your body builds memory. It's really, really good at it, which is what gets us in trouble sometimes. If you put conscious effort into rebuilding that memory, the trickle-down effect is amazing. So assess your posture, see where you can change it, make those changes, and then enjoy the benefit. Thank you for joining us. Next month, we will have another Facebook Live. Make sure you tune in for that. If you have any questions, drop them below in the comments. Thank you so much.